But I'd like to welcome you on behalf of Niagara Connects. My name is Patricia Regier, and we'd like to welcome you to this webinar. We are going to introduce the speakers momentarily, but we'd just like to let everyone know that the phone lines are muted. So please use the chat box on the computer section to type in any questions, or if you're having any issues hearing us, please type it there. And there is an opportunity for questions and answers at the end, but please feel free to ask questions throughout the presentation, and there'll be opportunities to answer throughout. And this is being recorded, so we are sending a follow-up package with the recording and additional information after the webinar. So again, my name is Patricia Regier. On behalf of Niagara Connects, we'd like to welcome you here, and we will begin this webinar. So this is results-based collaboration with the USAT initiative, and our guest speakers are Jenny Stranges and Despina Tzemis. And I'm sorry, I'm not pronouncing your names correctly. So if you could correct me on the pronunciation. Jenny is the program director at Quest Community Health Center, and she holds a BA in psychology, sociology, and criminology, and a postgraduate certificate in substance abuse and gambling counseling, as well as a master's in social work. Jenny has been employed in a variety of social service settings, including 20 years working with interdisciplinary teams in community health centers, both in Windsor, Ontario, and currently in Niagara at Quest CHC. Jenny participates in a broad range of community initiatives and planning tables across Niagara and has a strong commitment to social justice and health equality and equity. Despina is the program manager at Quest, and she holds a Bachelor of Science and Master's of Public Health from the University of British Columbia. Despina has been employed in a variety of research and community settings, including in British Columbia Centre for Excellence in HIV/AIDS and the BC Centre for Disease Control, Vancouver Native Health Society, and the Kingston Community Health Centre. She currently works in Niagara at Quest CHC, and she participates in a broad range of community initiatives, planning tables across Niagara, and has a strong commitment to enhancing client-centered care, community care planning, and harm reduction principles. We'd like to welcome both of you. Thank you to all of you joining us here on the webinar, and a special thank you to our speakers who are going to begin the webinar at this time. Jenny and Despina, you're able to begin the presentation.
Hello and welcome everybody, and thank you Patricia for the introduction. As Patricia mentioned, my name is Despina Tzemis, or for ease you can just skip the T and just call me Tzemis. And I'm the program manager at Quest Community Health Center. And today I'm co-presenting with Jenny, and we're excited to be sharing this webinar, which essentially is about collaborations and how when agencies work together, so much more can be achieved for our clients by developing these partnerships, building efficiencies, and creating pathways to ensure smooth system navigation. So just to set the stage, I'm going to highlight the collaboration of our Urgent Service Access team and their project management team. Moving forward, I'll often refer to our Urgent Service Access team as USAT for ease. Our discussion will include our guiding principles, a little bit of a discussion about guiding principles, provide a program description, and highlight the results based on our collaboration. We will then focus on strengths and challenges and highlight lessons learned. But before we get started, I think it's kind of important to get a sense of who's online, just to help sort of navigate where this discussion will go. And this question is extremely important to get to a sense to know you. So our first question for you, it's a polling question. If you had the ability to go skydiving right now, would you go? Who would go in the group? So if you're an individual, you can answer for yourself. If you're in a group, majority rules. If it's 50-50, rock, paper, scissors. We'll give you about 30 seconds. Wow, look at you guys go. So about 2/3 are the skydiving group. 1/3 is going to stay put, be firmly on the ground. So thanks for humoring us there and for answering that question. Now the next question is a little bit more tied to our conversation today. I want you to take a moment to think about a successful partnership that you were part of. So think about a characteristic of the partnership that was most important to you. Now we have 4 answers here, but if you could think back on your partnership, what to you sort of made that difference? Just take some time and choose one, and it'll just kind of help keep that in the back of your mind about some partnerships that you worked with that you felt was beneficial, and maybe kind of keep that in the back of your mind as we go through today's discussion. Okay, and wonderful. So we have answers across the board. Quite a few people noted trust as one of the main characteristics that was important to them. There was mutual respect. Common goal sort of was the highest one chosen amongst participants. And we have communication. And we understand that probably you could have chosen more than one answer, but thank you for taking the time and just reflecting on that. So I'm going to pass the phone over to Jenny, and she'll tell you a little bit about the project management team.
It's coming together as a project management team, and any collaboration is a lot like jumping out of the plane together, for sure. You need certainly to have that common trust. You need to have good communication and having that common goal, right? Landing softly, and certainly is a good description of the project management team and how we came together. I'll give you a little bit of a history. We started this project out with Niagara Health. It was Quest Niagara Health initially. We had been talking just about the hospital and their issue with having individuals who were so reliant on the ER for their care and weren't connected to other services, or were connected and there wasn't a common treatment plan or a common path to work together collaboratively. And so we wrote a proposal together, and then in that proposal and that process, we started to think about what partners need to be around the table, and just both to make it efficient, because it would be great to have everybody around the table, but you have to think about efficiency, but also who are those key players. So in that circle expanded to also include the CMHA, Canadian Mental Health Association, Niagara, and the Community Addiction Services of Niagara, CASN. All 4 partners moved forward, and we're talking about how do we work together on that common goal? How do we look at supporting those individuals with both to develop a common framework for help and support. So the purpose was to develop a regional resource that worked with our clients to ensure linkage and connecting to ongoing primary care, mental health, and addiction services, but also that address the underlying social determinants of health that we know are so critical to supporting individuals. It's not just about linking them to services, but it's also about meeting their basic needs to keep them engaged in services. So we talked about it in the framework of how do we provide support and system navigation, and how do we get around sort of a coordinated care plan. All the agencies around the table, we're doing great work in the community. We're supporting these individuals. But without that communication, without that common goal, everybody working on the same page, a lot of times we felt like we were spinning our wheels. So we wanted to come together and and try to be more effective collaboratively, which ended up in the USAT proposal going forward and successfully. And with that, we developed a project management team that was made up of those 4 organizations to help guide the resource that was funded to make sure it met those original objectives.
And the next slide is just going to talk a little bit about how the project management team got started and talking really about the guiding principles. So as many of you are familiar with this concept, but when developing a partnership, particularly if this is going to be a formal or long-term partnership, it's important to take the time to establish the guidelines of the working relationship. Oftentimes, you might hear your guiding principles fall under your partnership agreement, terms of reference, or memorandum of understanding. But we want to emphasize that investing in this time upfront will save time later. And for those of you whose workflow is a little more get it done, it could seem a little tedious, but this really is a time to invest in building a strong foundation. I was recently at a Leaders for Leaders training, and one of the nuggets that stuck with me is you need to go slow to go fast. This is a time to focus on relationships while keeping the work and tasks in mind. So below are some of the guiding principles of our partnership of the project management team. However, I won't go through all of them, but I will highlight a couple. So for us, our number 1 was our common goal. And identifying our overall goal was important. So when we identified that it was to be client-driven and ensure great client care pathways, we thought, okay, in order to do this, what do we need? Well, essentially, clients really don't care what organization they're part of. They really just need the care and support from providers. So we have this common goal, and then we work backwards that we really just need one team. So even though these are interagency clients, we really need to work together as one team because at the end of the day, it's one client. Another one of our guiding principles is accountability, and for us to make some systematic changes and to really sort of drive change and lead against the current, that the people around the table of the project management team needed to be accountable and were accountable to their organizations and were able to make decisions on behalf of their agency. So accountability was another one of our guiding principles.
So there were a lot of things going on in Niagara that also supported this collaboration and the effectiveness of this collaboration. There was the mental health addictions complex resolution table that had already been in existence. We had joined when we came to being at Quest, and it was a great table that was sort of already had the energy around doing this work, but this USAT provided that another tool in that toolbox to sort of link things and get them done. And there's been, since our inception, there's been other great synergies that we've been really reliant on as a collaboration, as a project management team. There's that great collaboration between Niagara Health and CMHA with 264 Welland Avenue, the co-location that's been phenomenal in supporting the work of the collaboration and the community as a whole. And around that time that USAT was formed, we had just finished the Mental Health and Addictions Charter. That was phenomenal. And also got, again, people around the table talking, communicating. There's the NAM group as well, the Mental Health Addictions Network that has been a great support to the collaboration. We had more recently the peer support program in the emergency rooms that is also going to be a great arm or tool to support the work of the collaboration. But the Open Network, the Conception Treatment Services through Positive Living Niagara, all those services have really created great synergy to get the collaborative idea of having a community care plan, having a community lead, and having one sort of thought of having one team support a client through the service network. They all collaborate and provide their synergies to creating success for clients. So when we looked at the USAT project management team coming together, we identified sort of what were the key resources that we want to make up USAT. So we talked right off the hop about it being a mobile outreach team. It had to be out where the clients were, engaging people at points of service. And our community partners offered up great points of service, both at the hospital, at withdrawal management, at addiction treatment facilities. So it was fabulous that the community came together to ensure that the service could be successful. And we talked about resourcing it. We talked about having a client coordinator, having a nurse practitioner providing primary care was key, because it started the treatment program before the treatment plan prior to it linking to that ongoing primary care. Could also do really practical things like get a diagnosis, write a prescription, fill a prescription. Having the registered practical nurses that are outreach as well was great. Having them paired with the outreach social workers. So you have that social work nursing collaboration. It's really been effective in ensuring that treatment plans have both lenses and take care of people's both emotional and physical needs. And then of course we also had a project manager to help provide oversight to the team. So the notions, the key pieces was having a shared care model. So those individuals shared care amongst themselves, they collaborated, they communicated, but they also worked really closely with those community partners, with CAS and with CMHA, with the hospital, as one treatment team in a shared care with client consent, right? As long as the client consents to it, that information can flow freely. We also talked about integrated treatment planning, the notion that they have one treatment plan that across all our disciplines internally and externally, everybody's working with that one goal. You mentioned that earlier when you talked about what was most important to you and you voted on that. Having one common goal, that's about having one integrated treatment plan. It's got to be client-centered, client-driven. It has to identify their priorities, but then everybody needs to be on the same page about working towards that. Other things that we did both internally and externally is looking at ways we can maximize scope of practice to ensure we're pushing down scope of practice, maximizing those registered practical nurses, maximizing the nurse practitioner scope of practice so that everybody's working through the use of medical directives and standing orders at full capacity, and create that no wrong door philosophy to help wrap services around the client.
So I want to just kind of give one sort of more detailed case examples of sort of the insight of the collaboration working together to make a practice change. Jenny spoke a little bit about the concept of coordinated care plans and the community lead concept. I just want to delve into it in a little bit more detail. So about 5 years ago, sort of in the mental health and addictions world, and amongst like the leads at the project management team, like we heard that Behavioral Supports Ontario had this concept of coordinated care plans. HealthLinks was sort of known, but it wasn't really as involved with the mental health and addictions sector at that time. And the project management team thought, this model of care, community partners working together, really having the client at the center, having a care team wrap services around, we need to do more of that. And so essentially, this group came together, kind of built even our own toolkit to help the staff at our agencies sort of really gain an understanding of community lead concept, and actually then connected with community agencies across both the mental health and addiction sector and other sectors to really get people on board with the concept of the community lead. So it really is identifying a client who would benefit from having a coordinated care plan, developing what identifiables the client has, their health status, and more around them about the social determinants of health, and who should be around that client to provide care. So this is one example of a coordinated care plan where a client was identified, linked with the Urgent Service Access team, and from there developing the care team. So we have the family provider, Positive Living Niagara for safer drug use supplies. We have Rapid Access Addictions Medicine Clinic and CASN to provide addiction support, diabetes education, and the client's ODSP worker. And sort of through time, the care team changed and where the client was in their care treatment plan change as rapport was built and services were, and the client was linking to these services. And over time as well, HealthLinks, as you know, has really expanded and broadened and really helped bring this initiative across Niagara. And we couldn't be more grateful actually for the lead of the transformational change that's happened across Niagara for our clients, and also onboarding to Health Partners Gateway as an electronic database to help share our coordinated care plans and the change that's made for our clients. In addition to, there was the Niagara Mental Health and Addictions Complex Care table that we spoke about, but now instead of having a one monthly meeting where we bring clients with complicated care needs to a table with providers, this coordinated care concept happens continuously among frontline staff, and changes are happening every day and not necessarily needing to wait till a formalized table, because care planning is happening throughout every day in the provider's work practice. So one of the changes that we have seen and the impact of sort of embracing this practice change amongst the other changes developed by our project management team initiative is we've seen that there's been an impact not just at the client level, but when we kind of look at also the hard statistics, we've seen change as well. So our most recent statistics had shown that clients who were part of the USAT initiative have seen a 47% reduction in emergency department visits. There has been a 53% reduction in admissions. There's been a reduction in low urgency visits, and clients have been reduced their readmittance 30 days later, so that has dropped by 65%. And the client experience has shown that 95% of clients who have taken part in the Urgent Service Access Team program and also through the development of coordinated care plans have been extremely satisfied with the care that they've received.
So when we talk about the project management team and some lessons learned from that group working together, that I think that there's some golden nuggets that can be shared across other collaborations. And so one of the top ones is that's time consuming. Time is required to create and develop one goal, one vision. In order to really get there, you need the same goal in mind. You need to communicate about it. You need to make sure that you're not making assumptions. Every organization, every culture has its own language. What we mean by things may be different in primary care, may be different than what CMHA means when they use those words. So you have to make sure you're getting on the same song page, that we don't make assumptions. We know that what we're talking about, and we have a shared understanding and definition of those goals, those outcomes, and those priorities. So in order to ensure that you're talking apples and apples, you need to do that upfront work. Things like the terms of reference, things like having those initial planning meetings to kind of talk about a plan to plan. What will we be doing? How will we be doing it? Besides that, we also need to talk about enhancing and filling a gap, not duplicating roles. Certainly there's room for everybody around the table, and everybody does a unique, different job, but at the end of the day there are some overlaps where maybe, for example, we support people fighting housing, CASN supports people fighting housing, CMHA does. So it's looking at where we can find synergies and leverage those resources across the organization. It's about who, for this client, would be the best person to do it, to do that role, and making sure that we're not duplicating and that person leads that piece of the care. So who does what, who can do what in a timely fashion, those are kind of the measurement tools, right? Okay, so maybe we do X, Y, and Z extraordinarily well, but they'll have to wait for that service. Then, okay, can someone else take that piece on who maybe it's not part of their first line of treatment, but they can do it and do it quickly. So if there's an organization that's expert in a certain area, to be able to lend that, but to fill those gaps and make sure that we're creating seamless service delivery. Also, there's always going to be competing priorities, right? Every organization has their own, every community has their own. So agreement around what the priorities are going to be as a collaboration is important as well. We're all stretched really thin. Every one of our organizations can use more resources, but there has to be an agreement that we'll make time for this collaboration and that we agree on what the priorities are going to be. And that includes for a big piece of that for our community includes participating in community care plans, ensuring that every organization agrees to invest the resources in that similar goal, because if we're all on the same sound page and everyone's completing the community care plans, then the idea is that the treatment will happen more effectively, more efficiently with a little investment of time up front. Another piece around developing, for us, lesson learned around developing an effective collaboration is ensuring that leadership and decision makers are around the table when needed. Having the right people is key. There are people who are invested in the collaboration and have the authority to commit their organization. I know everyone's really, again, busy, but if the decision makers aren't around the table, especially initially, then decisions can't be made, and we really don't have the commitment from the organization to move forward. At every step of the way, you need the most appropriate person. So sometimes that's definitely a decision maker, and sometimes it's front line. And if that front line isn't there, then again, services fall short. So ensuring that decision makers are on the table, but the most appropriate person is there. And the other huge piece is that programs need to be adaptable and flexible to meet client needs. It's about coming together around the table and taking the time to discuss what your organization can do to support the collaboration and the client's goals. I mean, everybody has their exclusionary criteria, but it's not about hanging on to those rigid criteria. It's about being flexible and figuring out as a community how we can support these complex clients who the community is failing. So having that adaptability and flexibility to be able to figure out how to make the service fit. And again, going back to that theme, investing the time up front. Without adding extra resources, right? Collaboration takes time. There's no two ways about it. Our understanding is that if you invest up front, you can streamline and save time downstream. It's proven to be truthful, it's proven to come to fruition, but people are hesitant at first to invest that time up front because they're sort of in the paddle, swimming upstream all the time. Also, supporting frontline staff in networking and learning about the programs and services. Our staff, everybody's staff needs to know each other, right? They both need to know, they need support from the decision makers that this is an initiative that's important to their organization. They need to have a clear understanding that information has to trickle down and trickle up about the goals and objectives. But a lot of great ideas die around the collaboration table because there isn't that feed-in or support from frontline staff. That it's imperative that those staff know what they're doing, why we're doing it, and that they have an opportunity to build rapport and build relationship. Things work a lot better if you feel comfortable and confident enough to pick up the phone and talk to Chuck, who's over at the other agency, and say, hey, this happened. It's kind of weird. What can your organization do about that? If you have a relationship and they know each other, that's going to go smoother than if it's a cold call. And lastly but not least, having that flexible solution-focused viewpoint. Once again, it's about what your organization can do to support the client and the collaboration goals. It's not about listing all the barriers that exist or how this doesn't fit with your typical everyday to-day functioning as an organization. Effective collaboration takes a solution-focused mindset, and you have to have that openness and willingness to change and flexibility. We've seen that time and time again with the program management team where people were willing to step forward, talk about how they could change their process, talk about how they might make exceptions for certain procedures because we gave them feedback or as a table that it wasn't working for our clients. So around the table, that goes all the way around. We've done it. Our partners have done it. We all have sort of processes that we develop. We think we're doing it for the most effective use of time and energy, but sometimes it's effective and sometimes it's not. So having that solution focusedness of being able to change and be flexible and adaptable is key. So in general, in conclusion, just the piece, some of the takeaways that we want to talk about is that it's identifying guiding principles in terms of reference for success up front is imperative. Without that mutual understanding for collaboration, the collaboration will fall flat. Also, identifying a common goal, right? Connected teams, connected people, connected communities. That's always been the goal of the project management team, and I think it's a good mantra for most collaborations. How do we ensure that there's that strong communication, strong connectivity, and that there's a community initiative? And taking time to reflect and evaluate on the collaborative in addition to the program and client outcomes. Without that building evaluation up front, you don't really know if you're off course, right? Right away for the project management team, there was a strong emphasis on evaluating the success of the collaboration as well as the service, and making sure we took time to reflect on that collaboration. The other piece is that really, as a USAT, Urgent Service Access team, we could not have done what we accomplished without the support of the project management team. It was paramount to the success of USAT. So without having those community partners around the table providing guidance, providing expertise, providing support, talking about being flexible and solution focused, we could not have achieved those goals. And it wasn't smooth always, right? And initially, there's always bumpy as you start to develop that whole, the collaboration, that whole norming, storming, performing, right? Getting to a place where you get to performance and you get to good synergy. And the other piece with that is that sometimes has to restart when you have different players around the table, because there's always changes in the organization. So you have a good synergy and good communication. But then you have a player who's moved on to another organization or is retired, and you sort of need to start over again and making sure that there's that terms of reference are understood, that the common goals are understood. But I tell you that without that oversight of the project management team, we could not have been as successful in getting those outcomes that Despina described earlier as we have been. We're really proud of the service, but we're really proud of the collaboration and the partnership and about the project management team and how we've worked together. Time and time again, our experience at Quest has been when we work collaboratively as a community, outcomes get achieved quicker, faster, better. So that concludes the presentation piece of our talk, and so we thought we'd open it up now to any questions.
Yes, thank you, Jenny and Despina. This was fantastic. Anyone can unmute your line by pressing *7. You can ask your question directly right now verbally over the phone line, or you can type in the chat box so that we can have some discussion. And Mary Wiley has asked, what strategies do you use to ensure that people at all levels in your organization understand the strategic importance of the USAT initiative?
Speaking from Quest's point of view, we ensured that there was presentations, that they gave updates during our program and services meetings, that people understood the service, how the service changed and adapted over time. When there was a change, we made sure that those changes were discussed. And we also went as a team to all our community partners and did presentations for them, as well as across the different community agencies that maybe weren't part of the Urgent Service Access team, project management team, just ensuring that communication was always happening, giving updates, giving some more information.
Yeah, thank you. Communication is so important. Mary's also asked, where do you see this work going in the future?
I see it expanding. I mean, we've seen some great uptake with the HealthLinks model and having the community care plans being adapted across the organization. More and more organizations are starting to get onboarded to Health Partners Gateway, which is critical because that's going to be the vehicle that we share the community care plans amongst ourselves. So having that electronic platform to share communication, having more agencies have access to that platform, and have more agencies buy on to the community care planning model in general. And as a stepping off point as well, with the work being done currently with the Ontario health teams in Niagara, which is another great collaboration amongst a huge number of community partners, where they've also adapted the community care planning model as their first year one strategy to look at service delivery for complex clients. So this is it's expanding like wildfire across the community, and it's can only benefit our clients. We're super excited.
That is very exciting. It's great to see that farther reach. Mary's also asked, to what extent is this model being used beyond Niagara?
Although the Urgent Service Access Team wasn't developed as a HealthLinks model, it certainly lends itself well to that work. That community care planning, really, early on they grabbed onto that and they ran with it. So from that aspect, I mean, the Urgent Service Access Team model is unique to Niagara for sure, but the Coordinated Care Plans HealthLink model has been a provincial strategy. So I think other communities have adapted that, and I'd like to think in Niagara we're doing it really well, and hopefully that will continue. But there is a different forms, different modifications. But as far as collaborations go and ensuring effective collaborations, I'd have to say it's hearing from our community health center partners across Ontario, it's definitely been there's been a lot of movement towards service integration from the standpoint of working collaboratively as two organizations, creating one service team, even though they belong to different organizations. That has definitely been spreading, and our community health partners, community health center partners across Ontario have all reported that they're doing a lot of that, and I think the Ontario health teams model is going to lend itself really well to that. It just pushes that need for collaboration. It puts collaboration at the forefront of how we do work, integrating services, collaborating, having seamless energy towards working collaboratively.
That's fantastic. We have another question as well. How are voices of lived experience incorporated into the USAT planning?
So right from the beginning, we've done a lot of work with client experience and collecting client experience. We've done focus groups. We've done client interviews where we've collected, what's working, what's not working. And so ensuring that voice around the table is there and that we're getting that feedback loop about how to adjust services has been important. As well, we often, at Quest, this part of the partnership, we often use our client advisory committee to feed ideas off of and look at program initiatives and changes. So we also have that loop of the client advisory committee to help guide our service delivery.
That's great. That's really great to hear. If anyone else also wants to unmute, *7, you can ask additional questions or type in the chat box. And I'm wondering, Jenny and Despina, that it's a unique circumstance for a management team to oversee an interagency project. Do you have any advice for other collaborative projects as to what missteps can they avoid or what things can they consider to plan ahead?
I think it's just reiterating some of the things we've already mentioned. One of the biggest, most interesting points for me is that whole idea that we could be using the same words but meaning different things,
yes.
right? And making sure that across the board, right, that everybody understands this. We have a shared definition for what we're calling collaboration, what we're calling joint treatment planning, and making sure that there's the room and space to discuss those things, to check in, to say, hey, I thought that we meant this. Isn't that, what did you mean when you said that? Because that organizational language can really be a stumbling block if people are not ensuring that they're talking the same language and meaning the same things. And the other piece I'd say is just time, right? Yeah. That's the other, just making the time. We have, in this community, I think some wonderful community partners across the board. This is one example. USAT is one example of a collaboration. There's other great collaborations in Niagara that also have service providers integrate services, have partners working together, and that there's a lead, but there's other agencies supporting that. And that I think it's the way of the future. I think that's the way services will be provided. So having that ability on both sides, from the lead agency, bringing those partners in and valuing their input and prioritizing, making time to make sure that they have that say, calling those meetings, ensuring there's continuity in communication, feeding back progress and evaluation, both the good, the bad, and the ugly, back to the community partners to say, here's what's working, here's where we're finding glitches. Taking the time to do that from a lead organization is key, we feel, but also those extremely generous community partners who come to the table, provide their feedback, provide their solution-focused problem solving, kick ideas around and generate other ideas. I know there's been lots of times with the project management team that we got to talking about something, we started discussing a certain issue, and all of a sudden 2 other initiatives or 2 other activities fall out that not related necessarily to the urgent service access team or the work done by that team, but that those agencies would pursue collaboratively outside of that, right? So both the generosity from the community partners, but the commitment from the lead agency to ensure that there's that collaborative feedback loop is key.
Fantastic. That intentional attention to those details, and as you mentioned, that commitment as well. And I appreciated before, as you mentioned too, flexibility, which is really important. So thank you. That's very good. We have another question. We hear a lot lately about the future potential around the use of AI or artificial intelligence in healthcare. Are there any aspects of the AI conversation that apply to supporting partnership models like USAT?
That's a great question. I'm not sure. It's not an area that I have a lot of expertise in, but I would say this. Electronic platform enablers, that is going to be the future of collaboration, period. And I'm not sure if that falls within the AI realm, but things like having access to Clinical Connect, Health Partners Gateway, having IDS, information decision support data, having that real, that good communication that links data together. Is so important. Things like Clinical Connect that informs people about, when a client's been in hospital, what the result of that was, what was the discharge, what was their medications leaving hospital. That's been a game changer for primary care, to be able to follow up and follow through and ensure that clients don't end up having to go back to ER because of unnecessary lack of communication. It's been phenomenal. Having the Health Partners Gateway platform now in place where we can share those care plans ensures that it's still kind of getting off the ground, but helps to ensure that it's getting the information is getting shared, and it shoots out emails to people when the care plan has been updated to say, hey, by the way, this care plan, there's been a change, right? It's really made the integrated community lead job a lot easier to be that chief communicator. And again, IDS data, information decision support data, that links both home and community care data with community health center data, with hospital data, and really highlights the client journey and where, who's been involved in their care, what I can't even tell you how valuable that has been to USAT. It helped us. It helps us evaluate our services, helps us look at the impact we're having on our clients and their use of services. But it's those type of electronic enablers are the future of healthcare, whether it be e-consult, whether it be one record, clients having access to their own medical record, which I know is coming soon. It's being launched by Niagara Health. Like those are the kind of things. I don't mean to be over dramatic about it, but those are the kind of things that end up saving lives.
Oh, great points. That's really something else for us to think about. Now, John has his hand up. John, are you able to unmute *7 if you'd like to speak directly to ask a question? And it's *7 to unmute your line, or you can type in the chat box. Okay. So an answer to his question for joining the phone line. Another question, how did you navigate the privacy laws? This kind of might connect to the electronic enabler platforms. Did you have a circle of care form for clients to sign, or was there
we
an
have
understanding?
This was developed by the project management team early on, a multi-agency consent form.
That's great.
And said and done, right? One of the privacy can sometimes be a bit of a barrier, but it's imperative that we maintain clients' right to privacy and that they are in the driver's seat as far as who shares care. But sometimes I think we default to this idea that privacy impedes our ability to provide that effective care. As long as the client consents, it's up to them. So once you get that client consent, then you're ready to roll, right? You can run with it. So ensuring that both that clients are in consent and they acknowledge what they're consenting to, they have a full understanding of that, and they know how to withdraw consent when necessary or when they choose to. Making sure that your client's well aware of all those pieces, but then for the most part, I would say for 99.9% of our clients, not having to tell their story over again and again and again, having agencies all working on the same page for the goals that the client themselves defined, those that they're excited about that. They consent and they find it. And having that one community lead to communicate with, that's some of the feedback that we get pretty key, that those have been some of the greatest rewards for clients, right? I have one person who's the lead on my care who I can communicate, who then communicates with all these other partners. I don't have to talk to 50 different people. I don't have to keep telling my story. I don't have to continue to be assessed, reassessed, and assessed. I don't have to continue to fill out the same questionnaire, same intake documentation over and over and over again. Those pieces, like they report the benefits of that, because most of the individuals we support, they're not at their best, right? They're coming to us because they're in crisis, they're in need of support. Things aren't working for them, and they're exhausted, right? Having those enablers those system navigators and system enablers that make life easier for them, they report that being so critical when they're not at, they're at some of their lowest points in their life, that those have been the life-changing, life-altering kind of things that they just couldn't deal with, right? It's one more thing.
That's truly client-centered, client-focused, and what they need.
We're always trying to ensure that we focus on that. I mean, the second you put any process in place, you risk the chance of creating a barrier, right? So we're always trying to get that client experience, client feedback to look at, okay, what ways can we be more responsive? What ways can we be more effective in ensuring we're meeting those client goals? And certainly we're not the experts in that, but it's always a continuous quality improvement exercise, and it's something that we are always working towards as a project management team, but as a urgent service access service as well.
And I appreciate too that you've mentioned communication so often and not making assumptions across whether it's the interagency team or with clients themselves of what they're needing. So it's fantastic.
Having individuals identify what their priorities are and what their goals are is key to the engagement, right? As healthcare providers, sometimes we're triggered or stimulated to work on what we think may be the most critical component of the person's healthcare, right? What may lead them to the worst health outcomes. But if that's not what the client's priority is, and you're pushing to start there, you end up losing the individual because they don't feel heard. If it's housing, if it's about finding a place to stay for the night, is about finding some food security. If that's their most important aspect of what's their priority today and not their blood sugars, even though they're astronomically high, you have to go there. You have to stay with that, because if not, you lose the individual.
Right.
That's not to say you don't continue to address or to offer support, but making sure that you focus on what their priorities are first.
No, definitely. And I do want to open up if there are any other questions or comments or to join in with the discussion. You can *7 to unmute your phone line, or you can type into the chat box. I'll just give a moment first if anyone else has a question. Well, if there aren't any other questions, I sincerely want to thank both Jenny and Despina for sharing this insight and knowledge with us. And I want to thank the entire USAT collaborative team for just really letting us learn from your fantastic collaborative experience. There will be a survey following when we end the meeting, and the recording and a follow-up package will be emailed to everyone. And I want to thank all of the participants for joining us with this webinar. And on behalf of Niagara Connects, we want to invite you to follow us on the different website platforms to be engaged with the Knowledge Exchange, the Niagara Knowledge Exchange, and Niagara Connects, as well as Living in Niagara report. So open it up again if there are any final questions from anyone or final comments from Jenny and Despina.
I'm not sure if Despina has something else she wants to add, but I would just I would like to sort of give a shout out to our project management team, Barb, Janice, and Tara, and just the hardworking, committed, really generous and collaborative partners they are from the hospital, from CASN, and from CMHA. Because without their commitment, without their hard work, this collaboration would fall apart quickly. And so I just need to acknowledge that they are really key players in the success of this service.
Absolutely. It takes everyone working together for these great outcomes. And Mary says that it's great to see this collaboration happening in Niagara, and absolutely concur and agree. So thank you very much, Jenny and Despina. Despina, did you have any final comments as well?
I just want to say thank you for everybody attending, and also just one nugget that I was thinking about in terms of client care. When I think when we first started doing coordinated care planning and community meetings, some staff were a little hesitant, like I'm not sure if this is going to work or how this is going to work. Just want to say that clients, everybody we've had yet to have one client say no to a coordinated care planning meeting with community partners, they really respond with, this is amazing, or I can't believe, this is everything that, I've wanted to happen this whole time. And when a provider's like, do you mind if I invite this community partner? You can hear what they have to offer. And clients they're really in, from our perspective and from our experience, sort of to do this coordinated care planning. So I just wanted to mention that for the most part, clients have been really appreciative and have been responding really well to community partners working together for their care. So I just wanted to add that.
Thank you. No, that's very helpful, because there can be misconceptions as to, it might be stretching people's comfort zones to working with other collaborative partners. And as you've mentioned too, all the time up front to set it up for success and that ultimate focus of the difference it's making. So thank you very much to both of you, Jenny and Despina, for sharing this experience with us and the outcomes and the positive results. And again, we have both the email addresses if there are any direct questions that you have for speakers, or you can send any questions to Niagara Connects as well, and we'd be happy to hear from you as well. So thank you very much.
I would echo Despina's gratitude as well to Niagara Connects, giving us a platform to share these. Time and time again, there's been phenomenal webinars provided through Niagara Connects, and it's been great to share information across the community. So we're lucky to have this resource in Niagara as well.
Thank you. Thank you very much. And we're looking forward to offering other webinars as we go forward, and appreciate hearing from the community and as to what is happening and what is working, what's the evidence-based resource that we have at our fingertips here in the community. So thank you very much.